Hi, everyone. What a great first session. Very exciting. And I'm really happy to be chairing session 2. And the reason I like session 2 is because it actually allows us to explore virtual clinical trials. So what actually is done out there today? What are some of the things that we've experienced? What are some of the lessons learned that we can look at? Some of the best practices or maybe future practices that we can look at. So the way this session will work is we'll have 2 presentations before the break and hopefully a little bit of time for discussion before the break. One of those is going to be on lessons learned from clinical care. And then the second presenter will be, I'm hoping he's here, Josh. Okay, awesome. And the second presentation will be on lessons learned from observational studies. So then we'll hopefully have some time for discussion. We'll do a little break. Then we'll come back for 3 more presentations on lessons learned for interventional trials. And then the exciting part, we'll have a panel where we've got 4 panelists who can give us some immediate reactions to those presentations and discussions. So that's the way the presentation is going to work. And before I present to the presenters and our panelists, we do have a really diverse group. So we've got a great list here. We've got folks from academia. We have folks from the government agencies, but then also sponsors and CROs. So real diverse perspectives. So we'll kick it off, but I did want to just share from me personally, being on the planning committee, just some insights as we actually, got the planning committee around the table, a virtual table. We actually, started discussing, of course, virtual trials and the realization that we're all defining virtual trials in a little bit of a different way. We saw some examples here, hybrid, full, maybe the future is we can choose our location. So that was some really interesting discussion and insight. You'll hear that certainly in session 2. And then the other piece of it, and a little bit of it's come out here today already, is really where are virtual clinical trials going to bring us the most value? So what patient population, what is that patient profile or even site profile that could lend to a good quality virtual clinical trial? So you'll hear all about that today. So let me go ahead and introduce the first 2 speakers, and then as I said, maybe we'll have some time for discussion. So we've got Jenna Boyke, who is joining us from Livinggo. So she's going to talk about some perspectives, some lessons learned from the actual clinical care. And then it's great to see Josh Denny in the back from Vanderbilt, who's going to talk a little bit about the lessons learned from observational studies. So if the 2 of you would come up, we can sit at the table, and you can use the podium or you can stay at the table.